Good morning. Welcome to the Healthcare Rule Breaker Studio. We're here with Derek and Angela. They are both nurses and they are living in Ohio. And I think it's like the Dayton area, right?
Yep.
I had the pleasure of meeting you guys through the Social Media Ambassadors Program, which I'm so thankful for the network, right? I mean, our network is our greatest superpower. So I want to jump right in. Derek, if you want to help, if you want to just start with telling us a little bit about who you are and what you've got going on, and we'll get the conversation started.
A lot's going on. So, good morning, everyone. So, my name is Derek Mayberry. So, as Alyssa had said, I'm from Dayton, Ohio, and I currently work for an organization in the heart of Dayton, Premier Health. It's a 5-hospital health system, and I currently serve as the system director of our ambulatory cardiopulmonary services. So, stress, echo, EKG, outpatient cardiovascular diagnostics, as well as hospital-based clinics such as our advanced heart failure clinic, etc. Alongside our joint venture within our cardiovascular service line with Christ Hospital down in Cincinnati. So a lot going on there. And Alyssa, you know how we met. And again, I'm very thankful for the connection as well. You know, I had the opportunity to step into a role, per se, if you will, with the American Organization for Nursing Leadership as the chair of the Social Media Ambassadors Program. And I was really looking at the time just to get involved with something with the AONL. You know, I really appreciated their mission and what they could do for nursing and nursing leaders all together. And once I got involved, I really wanted to say, like, how can I serve? Like, how can I really help the community in which I, have grown up in and as a profession and with my parents and that are nurses and my aunt. I really wanted to make a difference and make an impact. So when I started talking about engagement and membership and how can we get the voice of nursing out there, and again, this is at kind of where everything started, the heart of COVID, right? And I was like, I want to jump on that opportunity because I think that we have a opportunity to overcome a huge mountain when it comes to getting the nurse's voice out there throughout COVID, but and most importantly online in that digital age. And I had the opportunity to bring a partner along in this journey, Angela Whale. So Angela, I'll give you an opportunity to introduce yourself and your role at Premier and really how you got involved with this work.
Absolutely. Thank you so much, Derek. As I was listening to your first podcast and I was listening to your time with Rosa, what she said about I don't think of myself as a rule breaker. Derek and I had the same conversation that Rosa shared with you. And so I just wanted to mention we had this conversation about we have really come from a mindset of being rule followers. But when you use words that speak about boldness and courage and breaking through the norm, those were things I was like, oh yeah, those resonate with me. So Derek, thank you so much for getting us kicked off. I also have been at the same organization that Derek works with in the heart of Dayton for the 24 years of my nursing career. So I got to start, I always love to tell folks that my first job at my organization, they actually paid me the summer between my junior and senior year of nursing school to follow a nurse around. They paid me to follow a nurse around. Those were the days, right? So they introduced me really well to this organization. I also was a clinical nurse on an advanced care unit, a step-down ICU unit. I spent some time in the world of patient flow management. I was a nurse manager for an inpatient rehab unit, served as a director of nursing at our level 1 trauma center. And for the last 7 years or so, I've been working across the system. So I get to visit all of our hospitals and currently serve as one of our vice presidents in the Division of Nursing and the Chief Nursing Information Officer. So my eyes have been open to a whole new world with informatics and documentation and all things related to the electronic medical record. I had the privilege of working with Derek. One of our first interactions was through shared decision making. And so Derek is one of those that is incredibly bold and courageous and loves to try new things to see if they're going to work. And I love to be able to create the space to allow him to do that. So I really appreciated when he reached out to me and asked me to go on this social media journey with him, because he's definitely more of an expert in this space than I am, but certainly had a desire to create a different kind of narrative. Dr. Lawson, you talked about in the initial intro podcast, you talked about, how we create the narrative for what's going on in nursing.
Yes.
And I have a lot of passion around that right now.
Yes. Oh, I'm so glad you brought that up, because, man, the amazing work that's going on out there and the ability to raise our voice if we just get into it. So thank you both, because you are rule breakers, even though you're like,
we
wait.
follow the rules. But again, to Angela's point, it's really laser focused on that, doing something outside of the norm. Our profession over the years has continued to do things the same traditional way. And I really do think that was a pivotal point in our profession throughout COVID, where we started to really understand the voice of the nurse and really changing shared decision making into that professional governance, and really looking at ourselves as individuals as saying, how do we impact the work that we do on a day-to-day basis? Like, how do we really, how do we stop from going out there and just cold calling people to say, hey, won't you come work for me? Like, people really want to see that environment. They want visualizations. They want stories of culture, and they really are geared and really attracted to those things. And I think that is what just really got me involved with this work, and I have a huge passion about it, because I've had success stories from doing those things, and I've had the support of our own organization to go out there and do it. And we've talked to organizations across the nation that are doing some of the similar work, and it works. It is successful, and that's, I think, what really drives my passion behind this and to continue this work, and that's why I'm here today.
So I have a question. So how did you, we've done a lot of work around social media and really changing the rules. It's not necessarily that you're breaking them, but we have to change the thought process around them, right? And changing the rules and helping really leverage, like, changing the policies and how you partner with the staff and what information you can share and how you partner across the system, from, your marketing teams to your legal teams, managing your risk and things like that. So my big question is, how did you show and demonstrate that we can do these things? We can do these things. We have to assume and figure out, like, what the risk is and how we do them. But how did you navigate that within your system? Just even like if someone was looking to take a small step toward really engaging their workforce through social media.
Yeah, and I'm glad you really mentioned the word small step, because that's truly what it is starting out with that. So I think the biggest part of me was really just first partnering with the leaders that are supporting that work. So, going through COVID, I'll tell a little bit of a story. And then Angela, I want you to talk a little bit about some of the work we got to do with our marketing team in TikTok. But for instance, one of the things that I noticed throughout the COVID pandemic, when we were really trying not only to recruit staff, but also trying to mitigate the loss of individuals that were really chasing money and leaving the organization, and going out and experiencing new things because they got burnt out so quickly. Something that I realized is, I have people coming in where initially our rule was is you couldn't job shadow. You may be interviewing for a job and you can't shadow because of the risk of exposure. But as a prospective candidate, how do I really get to know if I'm going to like the environment or the people I work with? One of the things that we started doing is actually photographing and telling stories of awesome engagement initiatives that we were doing on the unit, or maybe a great patient outcome without, of course, disclosing PHI. Some of the things that come to my mind is, one at the first start of COVID, at the first Christmas Eve, when I was a nurse manager of our step down open heart unit, we had an agency nurse that we were working with that actually went on Amazon and bought little Christmas trees for all of the staff, all of the patients to have in their rooms. And it was because their families weren't allowed to come visit them in the hospital, but she wanted to spread the Christmas cheer. And I looked at that from the outside in that bigger picture and said, if I was a staff member and I was looking for another job, I want to work with a team that does something like that. Like, that's awesome. Like, just to show that not only they're committed to their jobs, but they're committed to just being an awesome and decent human being. Like, I absolutely love that. So we got the whole staff together. We had all of the Christmas trees on a beautiful table, and we took a picture of it, and it took off like wildfire on our Ohio Nurses Network Facebook page. And people were like, how do I contact you? And they're really saying like, oh, how do I come work for you? Or what can I apply? And we actually got candidates that would come in and wanted to apply for these jobs. And it was really just taking the narrative to really show what the culture looks like and what kind of members we have on our team. So that was really one of the first small steps that we took. One of the second ones, and I know Angela could probably resonate with this too, is really that internal staff to staff communication, staff to leader communication. One of the things that we continue to struggle with, of course, when you get burnt out is you're really not open to a whole lot more communication what you've already been receiving because of all of the things that are going on. We had nurse managers in the organization that really took the narrative and the initiative to start doing on their private Facebook group pages with their staff, doing virtual events where they could actually sit down weekly with the staff that maybe had been PRN or hasn't had a lot of communication. And, during that pandemic, things changed like wildfire. It was quick. It was fast. We had to do something different. We had to pivot a different way. How do we get this out to the staff outside of just waiting for their next shift, right? So we had nurse managers that would actually get on a Facebook Live and host a 2-hour event, almost like a virtual open office, and just really invited people to come hear what's going on in the organization, provide updates to the team. And I just can't tell you how much people appreciated that the manager was vulnerable enough to sit in front of a computer or even an iPhone and just have the conversation. Take the moment to have the conversation. And it was because of social media where it had the tools and resources available for that person to really go out and do that. So those are just two, I think, awesome examples of how the social media platforms can be utilized, not only for recruitment and retention, but also communication in general. There's so much that we can gain internally as leaders by leveraging some of the tools that are out there. And sometimes they may have a negative connotation to it. And we can talk a little bit about that here soon. But it's amazing what it can do. So Angela, I'll give you an opportunity to talk a little bit about some of those things, as well as the work that we've done in partnering with our marketing team as well.
Yeah, absolutely, Derek. Thank you. As I was listening to you and talking about those small steps that you took, the reason why those small steps were so impactful was because it provided an opportunity for our recruitment team, our marketing and communications team to see what a difference it was making. We had conversations before about how can we leverage these platforms differently. And, we have an internal social media platform too, right? Those internal to our organization that they prefer us to use because, just the fear of once we put it out in the world,
the risk is minimized
with it out in the world. And so by you starting with those small, like, look at how cool my team is and do you want to come and work for me too? It provided an opportunity for the recruitment team to see that return on investment. And I think really provided an avenue and a pathway for them to be more open to doing it differently and outside of the traditional way that we post positions. So thank you for being bold and courageous in that space. And then it took off, right? And then they were like, okay, so let's do a TikTok video. And so they had reached out and asked, what would it look like? We want to do a recruitment video that we can put on TikTok and we can show nurses why they want to come and work for our organization. And so in that space, we were thinking about, well, gosh, what makes us new and different? What sets us apart from others? And so I was very excited to be able to highlight some of the technologies that we had purchased throughout that time. And how that was different than what they would get at other organizations. So all of that started with lots of positive energy. And, as you talked about in the pandemic, the first couple of years of the pandemic, and I should be cautious because I probably a couple of years is too generous. So let's say the first 12 months of the pandemic, when we had lots of community support and we were getting lots of notes of love, that was a positive time because we were getting a lot of support. And then in the midst of that, my daughter decides that she wants to go to nursing school when she graduates from high school. And so that was a really hard time for nursing when we were 12 to 18 months into the pandemic, and nurses were tired. Nurses were burnt out. Nurses didn't feel the same level of support as we did in those first several months. And so the social media posts quickly turned to nurses crying in their car and recording how tough it had been and how distressed that they were. Even today, as I talk about that elicits a lot of emotion for our colleagues across the nation and for what we were having to face. And I was thinking, how am I going to tell my daughter this is a good thing? Like, how am I going to encourage her to actually do this? And so I started thinking about just what you had said, Dr. Lawson, about we control that narrative. We influence that narrative. And at the end of the day, is it worth it? Is it worth it to go into this profession that the four of us on this phone have felt so rewarded by? Mm-hmm. And so that was really the turning point for me about how do I influence the narrative, whether that's on social media or in different spaces. How do I encourage my daughter to go to nursing school? Just as recent as a year ago. So one of the first things I did with my daughter was I said, well, if you really think you want this, then it's time to go get a job at the hospital and see what we're talking about. You have to get into the space. You have to experience the space before you figure out if this is really for you. And just within the last year or so, she comes home from work and she says, Mom, I need you to be honest with me. Like, am I going to hate my job as much as all of these nurses are hating their job right now? And it created a really great opportunity to have a conversation around no job that we choose is going to have good days every day. We're not going to love 100% of it. In fact, my husband was standing there and he said, well, do you like what you're doing? Like, do you like what you're doing right now? Well, most of the time I like what I'm doing. And so talking about what is it about what you're doing that you appreciate? It is not about the tasks that we do when we show up, is it? It's not about the list of things that we did, but it's about the relationships that she's creating with the patients that she serves. It's about the impact that she's making, not just for her patients, but those that she works with. And so that leveraged us to have a really good conversation around this is an amazing profession to be a part of. Yes, you want to be a nurse. And how do we influence the narrative that we're telling our colleagues and our community?
Okay. Whew, I have chills.
Same, and so many questions.
I know. Okay, you go first, Crystal.
Oh gosh, where to even start? Kudos to you guys, both of you, because I heard you say, Derek, whenever you started the conversation, there's so many people in your family that are nurses. Mm-hmm. And Angela, your daughter is going to be a nurse. And I feel like I failed because my boys are like, absolutely not. I do not want any part of that. There are two things, though, that really stuck out to me. One, just the power, the ability to leverage. We're talking about social media to do a campaign of why this is so great and why we do this. And during the pandemic, I did a lot of work with the leaders all across the country talking about what they're experiencing, right? And some are in very high places, very low places. But you guys know what we experienced. And if I go back and read those journals, it is just, I will sit and cry. And the most powerful thing was bringing it back to that impact that we're making. I mean, you share the story of the nurse going to get the Christmas trees. It seems so simple, but what an impact on all those individual lives. Just beautiful. But I also want to just take it a little bit, something practical that could help the leaders that are listening to this. So you guys are putting out social media, and I've shared in a couple of podcasts that are yet to air. My son had a really bad motorcycle accident this summer, And so we spent a lot of time in the healthcare system. And in one particular spot, we were waiting, and, the capacity issues, all of that. And my brother is sitting there with us, and my son, he's 22. And he's like, what are they doing? Why is this taking so long? And so I'm wanting to stand up for them. And my brother says, look at them. They're working. They would rather be making nurse talks, not doing this. And I'm like, no, this is what the world thinks. And you guys are using it to help recruit, to highlight the great things happening in the culture, to maybe encourage people to pursue this, as it's just such a wonderful profession. But I'm wondering, what lessons have you learned along the way? And I'm hesitant to say that because I'm a rule breaker, so I don't like the guidelines, but I know that we need some to help do this. You talked about the open office hours. I've seen some really creative people doing this as just like their weekly huddle, like a little TikTok to get information out there, because some people do email and some people do the bathroom reads. But what lessons or guidelines have you had to learn to put into place to mitigate the risk?
I think there's a couple of different things. One of the biggest ones that I would say is really just trying to focus on, again, partnering with those leaders and bringing them in. So for instance, one of the things that I continue to do, and Angela could probably speak to this with the marketing team when we did the TikTok, is partnering with our consumer and branding relations, looking at, what things are we really abided by within our policy, but then again, kind of being that bold person and saying, is there a way that we can do this different? Like, in this policy, this states X, Y, and Z. Like, is there a different way that we can go about this and be safe with it? Also, something, again, when we talked about the small steps and making those strides into something a little bit bigger, when we started with those private Facebook group pages, that was just your internal unit department staff. That was something that you really just had everything private with your own team, whether the manager was in or not. You could have those conversations. And one of the things that we kind of branched out a little bit further is when we had to do some shuffles around movement with units, et cetera, because of, COVID capacity and how we were going to maintain some of that relationship building, we actually combined unit Facebook group pages into one. And we were able to really share ideas and different things that were going along amongst the unit. So for instance, when I managed the step down open heart unit, we had to move and shift some of our population over to our observation unit because our observation capacity went down. The majority of people were being admitted at that point in time. So we were utilizing some of that capacity, but had some of the same nurses that worked on that unit. So how do we bring them in? How do they be a part of our team? So we invited them and created a group Facebook page that really combined both units together. So that was just another way of how we really approached that and, kind of followed some of that policy and boundaries, if you will, associated with it. And then one of the other things that, when we started a lot of this work with the American Organization for Nursing Leadership, is I know that in my heart, I was putting myself out there on behalf of my organization, right? So it took me to take a step to partner with one of our consumer brand directors and say, is this okay? Is there a way that we can actually elevate Premier Health because of this? How do we really, how do we highlight the work that we're not only doing across the nation with a body like AONL, but how do we really show what Premier is doing to elevate that as well? So it really just took a lot of those initial conversations. I can really, piggyback on that with when we had an opportunity with Alyssa and Angela and a couple of other members of the team to present at the AONL conference. We had an opportunity to talk with so many different individuals that were like, well, how did you do it? Like, my organization is really stringent on these policies, and they're very very risk adverse to really not allow us to do some of these things. And again, it's just starting that conversation and show what's out there, because again, to Angela's point, there is success with things that we've done that. So if you're able to have supporting credible information to show them, there may be a little bit more likely to take your challenge and really turn it into a solution. So those are some of the things that I would mention. Angela, is there anything that you would add, throughout that journey?
Derek, you did a really nice job of summarizing. The only piece that I would add is don't wait for don't wait until you have like a final product or a perfect product to try something. It goes back to Dr. Adams, your first statement about one small step, just one small step, and then focus on iterative change versus trying to wait until you have it all laid out and perfect and ready to go.
Okay, so I have one, maybe two comments. I'm always wordy. You guys know. However, so one comment I want to make is things that I've heard you all say. So the two things that have stood out to me the most are authenticity and communication. So it's been the authenticity in what you've been sharing and posting. So real stories, real things that are happening on your units, real things that you all are drawing you all to feel more connected, that would resonate with other people that have resonated. So I think that's one thing that I just want to call attention to is like you all have shared, like it needs to be authentic. It's been authentic. You didn't use those words, but that's what that's what we're saying. And I do think that is what resonates people to understand the profession of nursing, our leadership journeys, how we are impactful to the business of healthcare, is that authentic presence. And it's not just about the other narratives that are out there on TikTok and various social media platforms. While fun or funny in the moment, they're not encompassing like the full impact of what we have to offer as a profession. And then communication. So one of the things that I think gave me chills in this call that I thought was like utter gold is that digital presence that you're speaking about, that the nurse leaders like had the space to be able to provide to their own staff, just being able to have like a digital office hours where maybe it's like not expecting that someone's going to be able to find the time when they're trying to care for their patients and they're trying to document and they're trying to get meds from pharmacy and they're trying to orchestrate all of these things during their 12-hour shift where they don't have time to pee, so let alone have time to do a drive-by to tell the manager something that they've been wanting to tell them.
Yeah.
And giving the staff that space to be able to free themselves of things that they're like, oh, hey, I needed to tell you about X, Y, and Z that are causing issues in our workday, or I want to recognize this person, this person, this person. But like having that digital presence that is part of their overall unit connectedness strategy. So I think people fail to realize that all of that goes into the strategy of how you support your team. And that we really can, eventually tie that back to metrics. And I just wanted to shout out that, we've been working on the project with AONL to support nurse leaders and how we do that. And metrics are going to be a big part of how you can have those crucial conversations with your leadership teams to get more support to be able to foster that digital presence and connectedness.
Yeah, and Alyssa, really quick, I'm glad you talked about metrics because that was one of my biggest things, and we can talk a little bit about that, about the toolkit and et cetera. But when I started doing a lot of this work, especially during that COVID time and really looking at recruitment, right? So, typical traditional process, you go out there online, you post a job, you wait for your talent acquisition team and your recruitment team to work that candidate, screen that candidate, get them scheduled for an interview. They come do the interview. It takes time, right? And it's lengthy. So, doing some of this work, I was like, am I getting recruits faster? Am I really looking at, are they reducing the amount of steps that they're going through to speak to the person that's actually going to hire them versus talking to someone that's their job, right? They're calling cold, whether it's cold calling, whether it's making the same call every day, text message, email to say, are you interested in this position? If I was a candidate, I want to talk to the person that's going to hire me right away because I want to know if this is going to be the right fit for me. When I was doing a lot of this engagement online and trying to really work for candidates and posting those stories and those visuals of our culture, I had an influx of people that were so excited just to get a direct message from me talking about like what to expect on the job. How many patients do you take care of? Like having that conversation that was just really quick and easy through the phone, right? It wasn't like you had to set that formal process up. Then when they came in, they could actually spend the time talking with their staff, talking with people that do the work on a day-to-day basis. So I continued to watch how many people liked the post, how many people commented or shared. That was a big thing for me. And then overall, when I looked to, when I actually went from a nurse manager to a director, one of the big points that I continue to talk about is really being innovative, but how did I really show success? So tracking key performance metrics like that. And one of the biggest things I was able to show is during that pandemic, I was actually able to reduce a vacancy rate of 20% and down to 0. And now granted, it doesn't stay 0 for super long. You have to work at it because you have those things, but it showed progress that an innovative measure that I was able to successfully lead was able to take that vacancy rate down. So there's credible information and data there. So I just wanted to share that because I think the metrics piece is so important to demonstrate that, especially if you're going to go challenge something with it.
Yeah. I just want to share my piece of gold, my cold chill moment. So I talk a lot about transactional and transformational leadership, and we need both, but in transactional, a lot of times what will happen is one small thing, and we put this ban on 0 cell phones, 0 social media related to your organization, right? Well, that's how I function. That's my computer in my pocket. You can't take it away. I've got to be accountable because of who I am.
Yeah.
And I love that you guys are embracing this because the new generation, I mentioned I have a 22-year-old. I also have a 17-year-old. And if there are policies in place of I can't have my cell phone, there are days I want to just strangle them because they don't understand. And then there are days I'm like, yes, they are going to change the game. They get it. So I just commend you for taking that risk, if we want to call it a risk, because my guess is, I don't want you to call out your organization, but my guess is there hasn't been anything like crazy. And if there has been, it's like a one-off that person's going to do what that person's going to do. It's like the remote workers at home. Oh, they're shopping. I promise you they're shopping at work too.
Yeah. So, yes, they were.
I love that. So thank you for just embracing it. That's where we are. And we've got to do that. So I commend you for sharing this.
Okay, this was such a fun conversation, and we're getting to the point where we have our healthcare rule breaker question. So if you guys were going to break any rule in healthcare, and it doesn't have to be the same rule for both of you. So Derek, what rule are you going to break? And then Angela, what rule are you going to break?
I feel like we've talked about the rule we want to break this whole time, but again, it's I would just say breaking outside of that social norm with social media policy, because I try to look at it from this angle. You only have so many people that can market for you in an organization. You only have so many people that communicate. You have a department typically in an organization for marketing and communications, but why not allow the other 12,000 people that work for you to get the message out? Tell them about how great our organization is. Tell them about all of the things that we're doing, because it attracts people to want to come work for you. And yes, there's ways to follow it and making sure that you're being risk adverse and you're being careful about what you do, but it goes back to partnering with your leaders. So I would just say break that norm of not allowing that social media piece, because it can do so much for you in the long run. Angela?
Mine has nothing to do with our conversation today because I prepared it prior to coming, and this is a conversation. So we didn't know where the road was going to take us. But I mentioned that part of my role is all about our electronic medical record and documentation. And gosh, I wish we could spend less time doing that. So my rule is if it wasn't documented, it wasn't done. We're not going to stand for that for forever. There are so many things that we do that we don't need to be documenting.
I love that.
Okay, preach. Okay. Angela just dropped the mic on us at the end of the conversation. All right. So I have one last question. If people wanted to connect with you, maybe have a deeper conversation, maybe talk to you about what's happening in your current organization, or if they had questions about how you really leverage social media in your organization, where can they find you guys at?
They can find me on Facebook, LinkedIn. That's really the only 2 platforms that I typically use. I'm very active on both. It would be remiss if I didn't put a plug in that here very soon you guys will have an opportunity to connect with our AO1L Social Media Ambassadors Toolkit out on the AO1L website that should be published here soon, hopefully by the end of the year. It really is a step-by-step guide on how to be successful with social media as a nurse leader. So I would lead you to that. But again, feel free to reach out to me on LinkedIn professionally, or even on Facebook. I'm perfectly fine with either one, very active on both.
And he is a Disney dad, so he's super fun.
Yes, he is a Disney dad. Facebook and LinkedIn are my two platforms as well. So feel free to send messages that way. And ditto to the toolkit.
All right, guys, it was an absolute pleasure.
Yes.
Thank you guys for having us.
Yes, this was so fun. Thanks for starting our Monday off right.
Yes.